Stop it! Fuck.
Hey boss.
Well guys, this week we have 3 patients who have arrived. So, c'est between you for the distribution. But I warn you, the patient who was operating on for the supraspinatus has a bad temper. Very bad. Okay? So, up! Well, have a nice day!
You too. Let's do a lot to find out who take care of grumpy people with a short straw.
We don't have a straw.
Oh, sir, this is...
No, but that's because I went to the swimming pool this morning.
Grumpy as you. Good luck.
Raise my students.
What's his name?
Brain.
Brian in the kitchen? Good morning.
Hi. Hi.
I'm physiotherapist. You can call me Tristan. I'd like to introduce my first intern.
Hi. Hi, my name is Jane. How do you feel? I haven't slept very well because of your bed being too hard, and this shoulder is painful.
Okay, I will ask them to bring you some cushion so that you can sleep on your healthy shoulder.
I don't collect cushion?
It's to stabilize you. Now I'm going to have a look your shoulder. Okay?
My shoulder is painful! Can I look too? Yes, but be careful!
Okay, let's go.
In fact, this patient has a rupture of supraspinatus, which is an essential muscle of the movement of abduction. Passive mobilization is performed to have the range of motion of the glenohumeral only and not all of the shoulder. Measuring the joint amplitude on the healthy side allows us to know the patient's abilities. Goniometry is a way of measuring range of motions passively or actively, which makes it possible to follow the patient's progress, to find the physical and pathological norm. This is a quantitative evaluations method which must be reproductive, comparative, simple, and inexpensive. The markers used are the upper surface of the acromion. We take the middle of the acromion, the vertical and the top of the olecranium. The motion is in the frontal plane and at an anteroposterior axis. Having recently undergone surgery, the patient lacks abduction amplitude. The rehabilitation will allow the patient to recover his full range.
On a scale from 1 to 10, what was the level of pain when I did this movement?
I will say 7 or maybe 8. 8.
Okay.
So I have found 90 degrees of abduction on the side.
Okay. So that's so bad. It's a good beginning. You see the progress quickly then to the re-education.
I hope so, because it's difficult to live with.
I see, you can reassure you. That's normal. You pain in this full or muscle in your shoulder, and that's why it hurts in this movement. Next time we start re-education. By then, take care of you.
Okay, thanks. But don't forget the pillow.
Okay. Goodbye, miss.
Bye. Bye. Bye, Jen. Say hello to Tarzan to me.
Morning, everyone. We are going to start the meeting by talking about the case of Mrs. Grumpy. Who is taking care of this patient?
It's me, Jen. This person who is hospitalized following a surgery of the supraspinatus.
Well, how do you think the rehabilitation is going?
The patient has made progress and his shoulder is less painful now.
Indeed, this patient reacted well to proposed re-education and seemed to be adapting well to this situation. I think the recovery will be complete because we have gone from 60 degrees of abduction to 80 degrees in a few sessions.
Great. Do you think the patient is enough autonomous to go home and to continue his rehabilitation in a private practice?
Given that he lives surrounded by this relation, we can envisage it. I will discuss this him at the next session.
Okay, good job. But sorry, I have something to tell you. I heard about your swimming pool problems. I have a cousin who makes some pills if you ever want to win to the next short strong.
Hello.
Hello. How are you today?
Good. The progress makes me forget the pain, and your cushion was a good idea.
We have some news to tell you.
Yes, we've been talking, and you think you're ready to go home. For real? That's great!
But there are two conditions. One, you must call a family and friend, and you must continue the re-education.
In private practice. Yes, of course. My husband will help me because he has nothing else to do. And for the physiotherapist, I already have one, and I will give you his contact details. Okay.
After rehabilitation in hospital, the patient goes home but continues his rehabilitation in a private practice, so the patient changes physical therapists.
Goodbye, sir. Goodbye, sir. Never. Hello, miss.
Hello, Françoise!
So, Miss Grimfield, supraspinatus. How do you feel today?
I feel better. I can move my arm, but I confess I can go shopping because I'm here almost Saturdays. The re-education is soon over.
Well, if you continue to do the exercise I gave you, it should be over soon. We are going to do a joint evaluation to see if your range of motion is sufficient for your daily life and shopping activities.
You know how to talk to women.
we are going to evaluate your movement. Jackson,
Yes.
you are going to evaluate the healthy shoulder that I see how you handle, and then you will tell me what you are going to do before I playing it. Can we have a look?
Yes, go ahead. I did some exercise this morning to warm up my joint, so it's okay.
Perfect.
Okay. Can I start?
Of course.
Okay. Can you sit down here, please?
Yes?
Miss, could you take off your shirt,
Yes.
please? So to start, I'm going to do a counter grip with my fingers. I'm going to do pinch with my fingers, with encompasses the clavicle with my fingers and the scapula with my palm.
Stop. Scapula? It's a shame. I like my shoulder blade.
I'm going to do a cradle hold with my free arm and do the abduction movement with blocking the lateral bell and the elevation of scapula. And I measure an abduction of 80 degrees.
Okay. Okay, perfect. Do you know another techniques?
Yes, but I prefer to do this one because it's the one I'm most comfortable.
Okay. I will show you this one. So, you put your hand more at this level for block the movement of the scapula,
Okay.
and you start. Okay. And that's it. Okay. Okay. And you have 20.
Okay.
See?
Yeah.
Thanks. Okay, miss, you can put on your shirt.
Yes.
And you conclude.
Okay. I can conclude that Ms. Grumpy has sufficient scope for the daily task she described to use during your first interview.
Okay, good work.
Does it mean that the re-education is soon over?
Yes. I think your education will soon come to hand, but you will have to continue the exercise I told you for a little while longer in autonomy to keep a good amplitude and strengthen your supraspinatus and your shoulders in general a little more.
Okay. I will end up more stronger than my husband if it continues.
I don't know about this, but it's certain that it's time to leave.
If you have any problem with your pool, you can call my cousin Pedro on 3630 3630. Don't be afraid to tell him that you're coming for me. Kiss!